And he said, come on in and look at this MRI. Okay. So I looked at it and he says, see this white spot right here? Yeah, that's your bicep tendon. See this black spot right here? Yeah, that's where it is about to disappear into. It was about to break. So went in, and that very afternoon, he said, well, meet me in my surgical operating room in Steamboat this afternoon. I said, whoa, okay, we'll take care of it. He's a people person, I think, and he's done well.
How was your day? What did you do today?
I worked my ass off. Yeah. Saw about 40 patients and had 2 meetings. I don't care who the patient is. I want every patient to feel like they are a professional athlete or as important as anybody that could possibly walk through the door. Honestly, that's how I approach every day. The reason that we created SOCI was to create a more vertically oriented delivery system for orthopedic care. Things are basically under one roof and provided in a way that's super efficient. A lot of times patients will call me and say, hey, look, I think I need an MRI of my shoulder.
Andreas and I have become close, so I can text him now and just say, I need help, or Margo.
My biggest team member is Margo.
SOCI is like my second home. Dr. Sauerbrey and I have been working together for 11 years now. It's been great to get to know both one another and the team that we've created. He has not only believed in me, but taught me so much about being a good surgical physician assistant and orthopedic physician assistant. We have a lot of fun together.
And more recently hired Steven, an athletic trainer, to help me.
My role in the clinic is to make sure that the patient understands exactly what the plan is. They will know exactly what the diagnosis is, what the general consensus of the conversation they had with Dr. Sauerbrey was, and then I will also reiterate a plan and answer any additional questions that they have about their healthcare moving forward.
Steven is a bit of a character. He's from Wales, and he's just the kind of energy that helps keep me going every day and makes my patients laugh.
You want to talk about your little airplane?
This? Chancellor? Yeah. Chancellor 414?
Is that its name?
Yeah, well that's the model. It's Chancellor. Cessna. Cabin class airplane. It's kind of old school. It's 41 years old. So, take good care of it. It's delicate.
The concept is that instead of having people to have to travel great distances to get health care, that you could provide their health care to them in their town. For the most part, a rural designation for a hospital is one that they don't have access to a full group of physicians or a full complement of specialists. So there are specific designations to that. And those hospitals exist in small towns all over the United States. It really allows you the opportunity to see different parts of the country within a relatively small area, but also to understand how other people live and to help them get back to what is important to them. So it's cool. You just get a lot of variety and a lot of different kinds of people, and I love it. They're my people.
Swinging on the keyboard
If you decide to be my patient, then I decide to be your doctor. And when I decide to be your doctor, that means I'm committed to being your doctor. That means I'm gonna stay up late and do your dictation. I'm gonna call you after surgery. I'm gonna do all these things that are necessary to make you feel like you are the most important person in my life and that you are my patient. And if I don't make good decisions, then you're not gonna have a good outcome, and neither one of us are gonna be happy with that. So I've spent the last 20 years figuring out how to make good decisions, so let me be your doctor.
Till I ever